So this is a study of sarcopenia, muscle wastage, in the elderly as a possible predictor of functional outcomes in trauma patients. So it's a study on the intensive care unit. And what they've done is to do a bit of an introduction on sarcopenia and why it's important in terms of frailty. And then they went through and said, well, this is a retrospective, so we've got access to the patient's notes, and they took the notes from subjects aged 55 years or older who were admitted to an intensive care unit. They did so they were admitted with trauma, and they did a CT scan. And from that CT scan, which they were taking anyway, they could calculate a muscle index, which is the muscle density at the L3 level, normalized for height. And then they looked at that and compared it to their functional status, which was measured with the Glasgow outcome scale, again, which they were measuring normally as part of their day-to-day activities in the ICU. And so just scanning through the various different tables, we can come up to a couple of interesting points. So 32% of the individuals were found to be sarcopenic, and the sarcopenia was a predictor of poor outcomes. So they're quoting an odds ratio there of 2.61. So anything over 1 shows that there is an association. So they're just skimming down to the end of this. They're saying, well, this could be used as a screening tool for individuals to predict whether they have a potential poor outcome on an intensive care unit. So measuring sarcopenia could be used as a predictor. So quite a useful study, I think.